The balance of the rates of the resorption versus depletion is affected by many different factors, one of which is the estrogen. An important consideration is the attainment of peak bone mass. Bone density naturally increases during childhood, reaching a peak between 20 and 30 years of age. Males generally achieve a great peak bone density in comparison to females. After peak bone mass attainment in women, there is a steady decline until the menopause, then an accelerated phase of bone loss until 60 years, followed by further steady decline until 60 years. After the age of 60, in women, the likelihood of osteoporotic fractures on hip and spine increases. Osteoporosis is defined as skeletal disorder characterized by compromised bone strength predisposing to an increased risk of fracture. It is more frequent in women than men with an approximate ratio of 4:1. रिस्क फैक्टर्स क्या हैं ऑस्टियोपोरोसिस के? फैमिली हिस्ट्री है ऑस्टियोपोरोसिस की, स्मोकिंग, एल्कोहलिज्म, स्टेरॉइड यूज है, हाइपोगोनाडिज्म है, मेडिकल ट्रीटमेंट कोई गायनेकल कंडीशन के लिए हो रहा है जिससे मीनोपॉज आपने इंड्यूस किया, डिसऑर्डर्स ऑफ थायराइड एंड पैराथायराइड मेटाबॉलिज्म, इमोबिलिटी, डिसऑर्डर्स ऑफ गट एब्जॉर्प्शन, माल न्यूट्रिशन एंड लिवर डिजीजेज. और ये हो गया प्री मैच्योर ओवेरियन इनसफिशियंसी. Cardiovascular. About 30% of all death occur as a result of ischemic heart disease and stroke. This makes cardiovascular disease a condition that significantly burdens the global health system. While management of CVD is not usually within the realms of gynecology, it is important to recognize that because many women seek the help of gynecologists during their life, there may be significant proportion for identification and improvement in modifiable risk factors of CVD. During the menopausal transition, there are several changes in the female physiology that can influence these include lifestyle issues such as nutrition and exercise, change in the distribution and fat from a gynecoid fat or breast and hips to android abdominal fat deposition, and changes in serum lipid level that includes increase in triglyceride, total cholesterol, LDL, cholesterol with reduction in HDL. Estrogen also has supportive effect on the vessels wall that favors vasodilation and prevent atherogenesis, effects that are reduced after the menopause. जब ईस्ट्रोजन नहीं होगा तो प्रॉब्लम तो होनी है. असेसमेंट ऑफ द मेनोपॉजल वुमन. Key to a consolidation around the menopause is not only to assess the impact of the menopause on the systems discussed above, but also to take the opportunity to appraise the presence of other risk factors, both modifiable and non-modifiable, that may affect the longevity. Modifiable and non-modifiable risk factors relevant symptoms क्या है, vasomotor, urinary tract है, sexual concerns क्या है, cognition कैसा है, joint pain कैसे, vaginal bleeding क्या है अगर relevant है, साइंस क्या है, ब्लड प्रेशर, BMI, विजनल असेसमेंट इंक्लूडिंग सर्वाइकल स्मीयर, ब्रेस्ट एग्जामिनेशन, लाइफस्टाइल, एक्सरसाइज कैसे, न्यूट्रिशन, स्मोकिंग, रिलेशन, सेक्सुअल एक्टिविटी, कॉन्ट्रासेप्शन मेथड, कॉन्ट्रासेप्टिव नीड्स कैसे हैं. पर्सनल वैसे तो मीनोपॉज का तो प्रेगनेंसी तो हो ही नहीं सकती. और पर्सनल गायनेकोलॉजी का सिस्टम, ऑब्स हिस्ट्री, एडमिनिस्ट्रेशन ऑफ ड्रग्स है, एज ऑफ